Hey guys, once again, it's your boy, Dr. Nchebe. Today we are discussing the tissues, and I really want you to gear up for this. For real. I think the tissues is one of my most interesting topics. Hold on. I want to ask you this question. Marfan syndrome. I know you must have heard of Marfan syndrome in terms of tissue, when you're discussing tissues. Marfan syndrome is a hereditary defect of elastin fibers, correct? Yes. People with this syndrome, what is the pathognomic feature? How can you differentiate it from every other problem with the tissues and with the elastic fibers? Okay, let me give you options. Hold on. Hyperextensible joints, small cranium, elastic bones, stronger bones, viscous blood. What is the answer? What is your answer? Okay, oh yeah, listen to this. Dash epithelium is the most widespread in the body. Which epithelium is most widespread in the body? Why? Which one is the rarest? Like, which one do you hardly see in the body? I want you to put your answer in the comment section below. Okay, hold on. Let me ask you this one again. The middle primary germ layer is called dash. What is the middle primary germ layer? Which gives rise to a gelatinous material. What is the name of the gelatinous material? Which then gives rise to a different type of connective tissue, such as bone, cartilage, and blood. So in this question, they are trying to ask you which epithelium is the primary middle part of the primary germ layer, meaning that you must know the primary germ layers. You must know all the primary germ layers, then for you to be able to know which one is at the middle, and you must know what they form. For example, the middle germ layer, what does it give rise to? So this question is that it gives rise to a gelatinous material, right? What is the name of that gelatinous material? Make sense? Okay, now another question is asking, where are chondrocytes and osteocytes located? We know what chondrocytes are. We know what osteocytes are. You must be able to differentiate these two things. And where are they located? Where are they? Then you see options like in the cartilage, in bone, in muscle, in lacuna, in plasma. Can you guess the answer? I need you to put the answer in the comment section. Please put the answer in the comment section. Okay, one more before we start properly. Okay, no, two more. Most kidney tubules are made of dash epithelium. And this epithelium is actually specialized for absorption and secretion. Which epithelium is that? First of all, there are different epitheliums in the kidney as a whole, right? But this one is actually specifically about the kidney tubules. The tubules are the ones that make the urine, right? They make fluid. So which epithelium is involved in this, all right? Very, very important for you to know. Okay, which type of muscle tissue is found in the walls of hollow organs? We have the smooth, we have the cardiac, we have the skeletal, we have the organ muscle, we have the elastic muscle. Which one? Which one? I need you to write down your answer in the comment section below, all right? Now, finally, the pseudostratified columnar epithelium of the bronchi in smokers may transform into stratified squamous epithelium. So now you need to know what pseudostratified epithelium is, that pseudostratified columnar epithelium is. Where are they found? Okay, fine. This is a giveaway. It's found in the bronchi, right? Now, they said in smokers, smoking will make it transform from the pseudostratified columnar to stratified squamous. What this change, this transformation, what is it called? You see why you need to pay attention to this discussion? So we are going to, I'll give you a little overview, very brief, a summary overview, you understand, in form of a slide. I'll discuss things, then at the ending, we discuss a lot of questions. But in between, I will also discuss a lot of questions. So please don't jump anything. I want you to follow this discourse word for word, all right? If I speak too fast, slow the video, slow down the video, and also take a pen and paper, make notes, look at the questions. Don't try to memorize the questions, no. Instead, try to understand the questions, try to know what other questions can stem out of it, all right? Because this is concept review. This does not replace your lecture slides, it does not replace your classroom learnings. No, this is just a review guide for you to be able to understand how the professors set their exams, especially for AP1, for AP2, and also AMP1 and AMP2, yeah, and also for NCLEX, for your board exams. So every college student that does biology and every student that is preparing for NCLEX and United States Medical Licensing exam ought to look at this video and understand that, oh, this is the maximum they can ask in tissues. This is the most things they can ask in tissues. So you need to read with this slide, all right? So as a form of introduction, there are a lot of tissues in the body, but remember, these tissues are made up of what? Cells. So group of similar cells that function similarly, they come together and they form what? Tissue. It's very important for you to understand this, extremely important. And also, the study of tissue is known as what? Histology. There are trillions of cells, 50 trillions, to different cell types, a lot of them. So all these cells come together to make up what? Tissues. I need you to understand this very well because it comes out in the exam a lot. Now, this is the part that they are always testing. This is the part that you inevitably must know. And what are they? That is the embryonic origin of these tissues. There are three of them. The outer one is the ectoderm, the inner one is the endoderm, and the middle one is the mesoderm. There's a question like this. I was talking about gelatinous tissue. What is that gelatinous tissue called? Mesenchyme. What does it give rise to? Cartilage, bone, blood. So mesoderm, which is the middle, gives rise to mesenchyme, and the mesenchyme indirectly gives rise to what? Cartilage, bone, and blood. That's BBC. BBC. All right? Okay. Now, the ectoderm, that's the outermost layer, what does it give rise to? Epidermis. There's a question that was asking about the epidermis of the skin. Where is it from? Ectoderm. Ectoderm, that's the outermost. But not just the epidermis, also the nervous system. Like if you look at the diagram here, you will see a whole lot of orders that ectoderm forms. Like what? Like hair, like nails, like skin, all those things. But all those things are part of the epidermis. Make sense? Okay, now the endo, because I've not mentioned the endo. The endo, lines most tracts. It gives rise to mucous membrane. Mucous membrane. Now that mucous membrane lines where? Digestive system, the respiratory tract, digestive glands. I need you to remember, endo gives rise to mucous membrane. Meso gives rise to mesenchyme. Endo, the mucous membrane, gives rise to what? Lines the digestive tract, the respiratory tract, the digestive glands. The meso does what? Forms mesenchyme, which gives rise to what? Cartilage, blood, and bone. Now, you are good to go. You don't need to stress yourself much. If you know this, you are good with the outer one because that's the highest thing they can ask you. Trust me. Okay, another thing you need to understand is how do you do section tissues, right? How do you section tissues? First of all, you should know that sectioning is you creating, tiny cells, a group of cells, that's tissue, cutting them, slicing them. Now, there is a way. First of all, histology sections are sliced, tissue sliced into thin sections. Thin sections. This is one question they can ask you because I will ask this if it's me. All right? Now, how are these things sectioned? How can you cut them? First, there are different types. You can cut them, section them horizontally, right? That's cutting along its axis, right? That's horizontally, cutting along its axis. Secondly, you can section them transverse, right? That's cutting perpendicular to its axis. So this is axis, this is perpendicular to it, all right? And the third one, you can go oblique. That's cutting at an angle between the cross and the longitudinal. Meaning that you need to know these three types, all right? Now, after that, after the sectioning, you do what? You fix. What is fixation? Fixation is when you put it in formalin, right? Formalin is a chemical that helps to preserve so that your tissue does not decay. Now, you stain. You understand? Different cells has different colors that they that they show better. That's for visualization. Then after that, you prepare smear and you spread. You understand? So all these things, all these parts are very important for you to know, right? Okay. Now let's go to the epithelial tissues proper. In terms of epithelial tissues, you need to know three important things. One is structure. Two is the other key features. Three is blood supply. Let me start with blood supply. Epithelial tissues are vascular. Please, if you see any question asking about the blood supply, epithelial tissue has no blood supply. All right. Now, because they have no blood supply, the question should be, how are they now, alive? How are they nourished? They are nourished by the underlying connective tissue. So this is epithelial tissue standing on the basement membrane. The connective tissue is below it, right? So this connective tissue gives it food, nutrient, blood, and everything it needs to be alive or to be part of the living system. All right. Now, the structure. Epithelial tissues are cells. Remember, we said tissues are made up of what? Cells. These cells are joined together. All right? The thickness varies. And most important thing you need to know is that the epithelial tissues covers body surfaces and lines body cavities. This is a question they can ask you. Remember one of the questions I mentioned from the beginning of this discourse? This is a question they can ask you. And they are usually exposed to internal spaces or environmental or the environment, like the skin. But remember, one of the epithelial tissues lines the the mucous membrane of the what? Of the digestive tract and other tracts. Very important for you to know. So it's an internal space. Now, there are key features. One of the most important I need you not to forget is it has two distinct surfaces. One is the basal surface, that is the leg, where it's standing on the basement membrane. Another one is apical surface. Two is that it has a basement membrane, which we already discussed. And three is that there are intercellular spaces. Four is that it has high rates of mitosis. These four things you can't forget because they will ask you. All right? Now, going to the functions of epithelial tissues, there are 6 functions that you must remember: protection, secretion, filtration, absorption, excretion, and what? Sensation. It's very, very important for you to know this. All right? This is a recap, so I'm not going too deep in discussing these things. Now, let's talk about the cell junction. There are 4 of them that you must know. 4. Tight, gap. Tight and gap. They are more like opposites. What is tight? Sealing cells together in such a way that nothing can pass, in between them. So this is one cell, this is 2 cells. We don't want anything passing in between them. That is tight junction. Now, when you are talking about gap junction is allowing these 2 cells to communicate, because in as much as they are matched by tight junction, there is something we call connexins or connexons. Connexons allow communication between the 2 cells. If you look at the diagram here, you will see what I'm talking about. Now, after that, you have the desmosomes and you have the hemidesmosomes. The desmosomes and the hemidesmosomes. These 2 are very important because in pathology, this is where you will see why we need to know this. Desmosomes. These are patch-like junctions that do hold cells together. And what do? They resist mechanical stress. You need to know the functions of each of them. Tight junction is so that something will not pass in between. Gap junction is for them to communicate. Desmosomes is for to avoid mechanical stress. Now, hemidesmosomes is the one that is holding, like a gum, holding it to the basement membrane like this, so that it doesn't slide. Okay. I don't want to enter into pathology. Remember, this is anatomy. Anatomy is what? Location. And physiology is what? Function. Now, in terms of class, we can classify you know what? I don't want to use this to discuss this classification. Let's use this instead, this diagram instead. It's very important that you pay attention so that you'll be able to understand this diagram. There are 2 ways we can classify epithelial tissues. One is by the shape of the cell, another one is by the layer. One is by the shape of the cell, another one is by the layer. So if you look thoroughly, what do you see? You see 3 different shapes. So classifying in terms of shape, we have the squamous. Squamous is like pizza. It's flat. You know this pizza pie? Yeah. I don't really like eating pizza. So the pizza part is squamous, flat. Squamous, flat. Squamous. All right? I need you to remember. That's the first one. The second one is cuboidal. It's like a cup or cube. Cup, like this, or cube. The third one is what? Columnar. They are tall like columns. You can't forget. So anytime you see tall cells, it's columnar. If you see flat cells, it's squamous. There's no 2 ways about it. Now, in terms of layers, there are 2, maybe 3 classifications. One is they can be in one layer. What does one layer mean? If you look at this, this is one layer. All the cells, this is basement membrane. All the cells are resting on the basement membrane. So if this is 4 cells, if the 4 of them, their legs are touching the basement membrane, that is what? Simple. That is what? Simple. So if you take your microscope and just look, identify the basement membrane, look at all the cells. If all of them, they are full touching the basement membrane, that is simple. That's one layer. Now, when you're talking about stratified, that is more than one layer, right? More than one layer. It can be 2, it can be 30, it can be 50 layers. And it means that they are standing on each other. So if this one is standing on the basement membrane, one is standing on it. So if you just look at the microscope and you see that there are some that are not standing on the basement membrane, instead they are standing on the other cells, it is what? Stratified. Simple and short. Now, if you look down, you see the pseudostratified. This is crazy. Why? Because the pseudostratified, its aim is just to confuse you. It just want to confuse you. All right? It's trying to tell you, oh, I am stratified, but it's not actually stratified. If you look closely, you see that all of them are matching, or their legs are on the basement membrane. This is a very important information to get, because this is a very special type of epithelium, always found in the respiratory tract, always. it always has cilia many a times. You see, finger-like projection, look at it, you see the cilia. So the pseudostratified, if you look at it and it's standing, this thing is not too clear. Some are like they bend on the others, trying to confuse me. That's what pseudo. The word pseudo is false. And all of them has hairs mostly. Why are they having hairs? Because they have goblet cells. So the goblet cells produces mucus. This mucus trap foreign particles, and the cilia then drives it out of the respiratory tract. So it's always, if you hear pseudostratified, respiratory tract. So these are the three major. Now there is also another stratified that is special, very, very special. We call it transitional. Look at it, transitional. Where is it found? Usually found in the urinary tract. That is ureter, and that's ureter, U-R-E-T-E-R, not tra. Ureter and what? And the bladder. Ureter and the bladder. Anytime you hear transitional, ureter and the bladder, meaning what? That it stretches. If you look at it here, it looks flat. Look at it here, it looks cuboidal. Look at it here, it looks flat. So it has stretched from, it was like this before, stretched to this. So you need to be able to understand this. Now let's go into each of them, one after the other, because there are specific questions they ask. The questions can be in terms of structure, it can be in terms of function, and it can be in terms of location. What did I say? The question can be in terms of structure, it can be in terms of function, and it can be in terms of what? Location. The first thing you need to know is the structure. For simple, remember this is simple squamous, it is flat. Simple squamous is flat and single layer. All right? Now, what is the function? Because it's flat, things can easily go in us. So it permits rapid diffusion and transport of substances. That's your question. Rapid diffusion, transport of substances, right? It facilitates diffusion, filtration, and gas exchange. So because it's flat, things can go in and out, in and out, in and out. So where in the body does rapid diffusion happen? In the alveoli of the lungs. That's the one they usually, okay, fine, it's found in the glomeruli of the kidney, in the lining of the blood vessels, but please remember alveoli of the lung. That's your question. If you go to your board, that's the question they usually focus more on. So this is for squamous, so there is no biggie. Just know this function, know the structure, and know the location. All right? Now, simple cuboidal. It's very, very important for you to also know these three things. Simple means it's one layer. Simple. One layer. Cuboid is like, cube or cup. Now, what's the function? For absorption and secretion. Anything that is cup, means that you use it to take water, right? So it's usually found in secretory surfaces. Anywhere that produces water, you find it. Like where? Look at it. The kidney tubules. Tubules produces urine. The thyroid, the liver, salivary fluid, mammary fluid. It's very important for you to know. Simple. Cuboidal epithelium. All right? Now, another thing you need to also know is that simple cuboidal epithelium is found lining ducts and tubules throughout the body. Ducts. What is ducts? Duct is pathway that helps for the passages of fluid. It's as simple as that. The same thing with tubules. So that will help you to understand. This is cuboidal, cup. All right. Now, simple columnar. Also very important things for you to know in simple columnar. Right. Number one, its location. Location is found columnar, column. It's helping for increasing absorption. If you look at the diagram, you see the columns. Look at it. You see the columns? It helps for absorption, increases the surface area. So where does absorption happen? The digestive tract. The digestive what? Tract. And when you're talking about digestive, you're talking about from the stomach, right? Not esophagus, because esophagus is, we are talking about it later, the stratified squamous. But this is simple columnar. So it lines where, lining of the GI tract, the uterus, where the uterine tubes. Lining of GI tract, the uterus and the uterine tube. And what does it do? Absorption and what? Secretion, particularly. Now, one of the questions that they will ask you, does it contain goblet cells? Yes. Goblet cells are those same cells that are found on the pseudostratified epithelium that I mentioned initially. They produce what? Mucus. You can only see them in pseudostratified and what? Simple columnar epithelium. So if they ask you, tell them goblet cells. All right? And also, it is single row of tall, narrow cells. Look at the tall cells. You see how they are tall. Tall, narrow cells. Another way you can be able to differentiate this from pseudostratified is that if you look, this is tall, Pseudostratified is also tall, but this is the nucleus, right? You see how all the nucleus are in the same, are well arranged in the basement membrane. If it is pseudostratified, you see that there are some nucleus here, because as the pseudostratified is trying to confuse you, it will push some of the nucleus up. Wisdom, right? Good. So I need you to understand this. It has brush border to increase the surface area. So bear in mind that this a simple columnar is very, common in the boards. Now, pseudostratified, we've already discussed that. If you look at this, you see, look at nucleus, nucleus, up, nucleus. So it's trying to confuse you. You see, it's trying to tell you that this guy is sitting on this guy. Trying to tell you that this is one layer, this is another layer. But if you look properly, you see that all the layers are touching the basement membrane, all of them. Assuming this is arranged, this would have been columnar, but this is not arranged. So this is simple. See, this was pseudostratified what? Columnar, not simple columnar. This is the cilia, you see? Goblet cells giving out mucus. So it often has cilia and goblet cells, appeared multi-layer due to nuclei at different levels, but it's actually one layer. That's the most important thing. And it secretes and propels what? Mucus, found in the respiratory tract, and also some parts of the male urethra. Remember I said ta, T-E-R, urethra is transitional. Okay. As we are progressing, I need you to also know, some certain things in terms of stratification. Now, we are done with simple. The second classification is stratification. For stratification, only the one layer is on the basement membrane, others on top. So it can be 2 to 20 layers, right? Others are on top. And stratified squamous is the most common epithelium. They will ask you this question. If they ask you what is the most common, it is stratified squamous. Which one is not common? Which one is the rarest one? Is stratified cuboidal or stratified what? Columnar. Stratified cuboidal or stratified columnar. Even think about it. Why will anything want to be on a tall something? You want it to fall off, right? And the special type is transitional. I've already discussed that. Now, let's take them one after the other. When you are talking about stratified squamous epithelium, stratified squamous. I want you to always study this in terms of structure, know it in terms of structure, types, and function. Structure, types, and function. So for structure, there is multiple layers, right? Because it's stratified. Squamous is flat. Multiple layers and flat. Simple. So you see, basic the cells below, they push off the ones up. You understand? They divide and they come to the surface and disappear. Divide, come to the surface and go out. You wash them off. That's something we call exfoliation or desquamization or desquamation, right? So this is sloughing off of the dead one up. All right. Now, what are the types? It can be keratinized, it can be non-keratinized. It can be keratinized, it can be non-keratinized. So for the keratinized one, the dead one, the one that are filled with keratin, they are the dead ones. That is the skin. So the skin is the only keratinized squamous epithelium. If you just hear keratinized squamous epithelium, please think of the skin. And it is the most widespread. So when you hear, oh, what is the most widespread? Skin is the most widespread organ. Yeah. And what epithelium is the most widespread? The epithelium on the skin, which is what? The keratinized stratified squamous epithelium. And when you're talking about non-keratinized, everything that is from the outside inwards, think about it. The mouth is like invagination of the skin. So it is what? Stratified squamous. But this time around, it is non-keratinized. Anything inside the body is non-keratinized. Now, look at the anus, for example. It is also from the skin folding inwards. That is stratified squamous, non-keratinized. Look at the vagina. It's also the skin folding inwards. That's stratified squamous, non-keratinized. Look at the esophagus. It's also the mouth and the skin folding inwards. So remember the mouth, the esophagus, the vagina, even the anus. All these things, non-keratinized, stratified squamous epithelium. I don't know if you get it. If you have a question, please drop it at the comment section. Click like. Don't leave this video without clicking like, please. Also, leave comments. I really want comments. Tell me this video is good. Tell me, the topics you want me to make next. Also, click the notification bell so that you always be reminded. All right? Now, proceeding, after the structure and the type, the function. Anytime you hear stratified, it is for protection. Simple. Protection. Against what? Abrasion, against desiccation, against, pathogens. Extremely important. So those cells that you see stratified squamous, they are always cells that has abrasion. Like the mouth, for example, you put a lot of food in the mouth. The esophagus, food goes, so it scratches it. So it has to be tough. Same thing with the vagina. A lot of things enters in there. So it has to be tough. Same thing with the anus. All right. So it's very, very important for you to know these things. Now, transitional epithelium. Transitional epithelium, which is a special type of stratified epithelium I will discuss. As I told you, always learn it in terms of structure, function, and what? Location, because what you are doing is anatomy and physiology. Anatomy is what? Location, location, location. And physiology is function, function, function. So in terms of structure, the transitional is actually modified. That's why it's also called what? Urothelium. So if you see urothelium, you are talking about transitional. So if they ask you, oh, what is the epithelium of the urinary bladder? It can be what? Transitional or urothelium. You will see one in the option. You can't see the two of them in the option because they're the same thing. Now, why are they transitional? Because surface cells can change from rounded to what? Flat. I've shown you before now. I've shown you before. And what's the function? For expansion of that organ, right? You are building up urine. Urine is like maybe 20 mils. It's just still normal. 50, 100, 200, 300, 400. You see how my hand is expanding? This is the bladder expanded, expanded. And when it has expanded to the maximum, you cannot hold it. You have to run to wee. All right? So that is the function. So it's found in urinary bladder, it's found in ureter, and it's found in renal pelvis. These three things are the same thing. Why? Because the renal pelvis, from major calyx, the fluid enters the renal pelvis. From the renal pelvis to where? The ureter. From the ureter to where? The bladder. So that's why they have the same thing. Very, very important for you to know. All right. Now let's go to glands. Let's talk about glands briefly. There are important things for you to know is the definition. Why? Because glands, cells, organs that secrete substances. They secrete substances that are usually composed of epithelial tissues in connective framework. Very important for you to know. Very, very important for you to know. Now, the main two types of gland is the exocrine and endocrine. Exocrine is the one that has contacts, meaning that, I want to go to somewhere. I drive a car from my house to Brooklyn. That's exocrine. There's a duct, a point of contact, a channel. But endocrine, I need to pass an information to Brooklyn. What do? I just make a call, right? There's no point of contact, no duct. So endocrine is ductless. They secrete hormone directly into the blood. Example of endocrine, thyroid, adrenal, pituitary. You go watch my endocrine video so that you understand properly. Go watch my endocrine video. All right. While the exocrine, you talk about the sweat glands, the tears, the salivary, the digestive. Also watch my digestive video and also my urinary video. Very important for your exams. Very important for your board. Though there are some glands that, can serve both the exocrine function and endocrine function. I'm not going into that now. All right. Now, when you talk about the exocrine, we already discussed them. They are simple, they are compound, they have parenchyma, secretory, and the stroma, and all those things. I'm not going to talk so much about them, all right? Now, there are types of secretion that they give, which is the serous gland, the mucus, and the mixed glands. So the serous produces thin, watery excretions, like the digestive enzymes. So if they ask you, the digestive enzymes, they are serous secretion from serous glands, right? Now, the mucus, you know what mucus is. We've discussed goblet cells. Important for you to know. Very thick, viscous. Then there are some that are mixed, right? So that leads us to what is the form of their going out. We have the merocrine, we have the apocrine, we have the holocrine. Merocrine, apocrine, holocrine. Mero, from exocytosis, boom, it bursts and it moves. Apocrine, you understand, it's budding off. Why holocrine is disintegration of the entire thing, so that whatever it produces will come out. Simple. You don't need to know more than this. For real. Especially for your college exams, for your college AP and AP1 and AP2. All right? Now, one of the most important things you need to remember is membranes. There are three of them. We have the cutaneous, we have the mucous, and we have the serous. The cutaneous membrane, the mucous membrane, and the serous. Very, very important for you to know this. Extremely important. When you talk about cutaneous, you're talking about skin. So what is it? Stratified squamous, epithelium, keratinized. Stratified squamous, epithelium, keratinized, cutaneous membrane, cutaneous. When you are talking about mucus, it's very important for you to know that mucosa, usually mucous membrane are the ones that lines anything going to the exterior. Anything going to where? The exterior. The layers involve the epithelium, the lamina propria, the muscularis mucosa. I'll discuss this later, right? They often contain goblet cells. Very, very important. So where do you see mucosa? Digestive tract. Think about it. Digestive from the mouth. So it's coming out from the external. Anus is coming out from the external. Respiratory. Your lungs coming out to the external, to the nose, and all those things. Urinary, coming out from the urethra. Reproductive, coming out from the vagina, coming out from the penis. Anything that lines exterior passageway, anything that comes out, that is mucous membrane. Always remember it. Always remember it. Then we have the serous membrane. That's the serosa. Serous membrane, they line body cavity and they cover organs. So if you bring out the heart, if you have done heart dissection, for example, if you bring out the heart, you see that it's covered. Those things that covers the organs, the liver, all of them, they have covering. This is called the serosa. That's the serous membrane. And they are usually simple squamous epithelium. Simple squamous epithelium. They produce fluid, yes, for lubrication. So, for example, the heart, the lungs, you see pleura covering it. The heart, you see the pericardium covering it. All the stomach, the intestine, all these peritoneal organs, you see what? Peritoneum. So all that are serous. So you must know cutaneous is skin, mucosa is lining the external, usually systems like digestive, respiratory, urinary, reproductive, right? And serous is lining organs. Very important for you to know. All right? Now, let's go to connective tissue. Overview of the connective tissue. Connective tissue is the most abundant tissue in the body. If they ask you, what is the most abundant tissue? Connective tissue. The cells usually occupy less space than matrix, right? And not together. Epithelium, they are together, they are packed together. Connective tissue, they are not packed together. All right? Now, the matrix contains fibers and ground substances. The fibers include collagen, elastic, and reticular. I'm not going too deep into it. The ground substances are like fluid-like, gel-like substances, right? That holds things together. So the matrix, you see, then you see a lot of abundant cells in it. That is called connective tissue, right? What is their function? There are different types of connective tissue. They have different functions. For example, the blood is a connective tissue. What is it used for? For transport. Others for storage. Others for defense. Others for support, protection, and connection. Very, very important. Now, what are the cells? You must know the cells. Fibroblasts, which produces fibers and ground substances. We'll discuss fibers and ground substances. Remember? We have the macrophages. It's phagocytized. What is phagocytation? It opens its mouth and swallows the foreign material. So it helps for immune system. Same with leukocytes. White blood cells. Leukocytes are white blood cells. You understand? You talk about neutrophils that attack bacteria. You talk about lymphocytes. Remember, leukocytes are divided into 5. The basophils, the eosinophils, you understand, the mesophils, right? The neutrophils and the lymphocytes. Specifically, the neutrophils and the lymphocytes are very important because the lymphocytes react against foreign agents, while the neutrophils fight against bacteria. Also, the plasma cells, which helps to synthesize antibodies, formed from the B lymphocytes. B lymphocytes, they mature in the bone marrow and they migrate to the lymph nodes. And the lymph nodes, they differentiate and becomes what? The plasma cells. After that, the plasma cells now synthesize what? Antibodies. This is the pathway. Also, the mast cells, which releases histamine and heparin, then adipocytes. These connective tissue cells, you cannot forget them. Like, you can't forget because they can coin these questions in a lot of ways. Now, let's talk about the fibers of connective tissue. With the fibers, we can divide connective tissues into 3 different types. In terms of fibers, we have the collagenous, we have the reticular, and we have the elastic. The collagenous is the most abundant, 25% of all proteins, right? It's very tough. Collagen, very tough, resistant to stretch. Where do we see it? Tendons, ligaments, and dermis. Tendons is usually the end part of the muscles that attaches the muscle to what? A bone. Ligament joins 2 bones together. Dermis is the skin. All right? So tendons, ligaments, and dermis is part of the collagenous fibers. Collagen, they're produced by collagen. While the reticular, right, that's when you are talking about collagen that are covered by glycoprotein. So if you see collagen covered by glycoprotein, it is what? Reticular fiber. Reticular fiber. Elastin is different. Elastic fiber is very, very different. It's made up of elastin protein. That's why it can stretch. It can stretch. So if you have more elastin than more collagen, everything about you will be stretching. All right? Very, very stretchy. Okay. When you're talking about ground substances, they are, as I told you, they are thick gel-like gelatinous material that are very, very consistent. All right? They have around 3 types that are very important to us. It's not an all-inclusive list. So we have GAGs, that's glycosaminoglycans. We have the proteoglycans, and we have the adhesive proteins. Example of glycosaminoglycan is chondroitin sulfate in cartilage. So if they tell you, oh, these are examples of ground substances, they tell you GAGs, they tell you chondroitin sulfate, they tell you proteoglycans, they tell you adhesive glycoproteins, You should know that all of them are examples. So the one that is not an example, they will tell you all the following are examples except one. Or one of the following is not an example of ground substance. Or one of the following is an example of ground substance. They really love it. All right. So now let's go to, we've discussed the cells of the connective tissue. Let's go to the types of connective tissue. The types. Now, in terms of the types, what do we have? We have about 4 types. We have the blood, which is the fluid connective tissue. We have the bone, which is the osseous connective tissue. We have the cartilage, which is divided into hyaline, elastic, and fibro. And we have the connective tissue proper, which is divided into the loose, that's areolar, reticular, adipose, and also the dense, regular, and irregular. Right? These 4 parts are very important for you to know for your exams. These 4 parts, extremely important. The bone, the blood, the cartilage, and what? The connective tissue proper, divided into loose and dense. Now, let's discuss them one after the other. When we want to start with the connective tissue proper, correct? Now, the connective tissue proper, we say it has loose and it has what? Dense. Let's talk about the loose. Loose, it is loose, meaning that the organization of the fibers is loose. Simple. And because it's loose, a lot of blood vessels is able to pass through it. Example is areolar tissue. Loose connective tissue, example is areolar tissue. Very loose. Blood vessels, a lot is passing through it. So if they tell you the most vascularized, you're talking about areola. Areola. And remember, I told you that epithelial tissue is like this, then the basement membrane is like this, then connective tissue is like this. The part of the connective tissue that is very close to the basement membrane from below is the areolar tissue. And because it has abundant blood vessels, it has enough to give to the epithelium. Think about it that way. Another one is reticular. This one is more like fibers, right? Like framework for the lymphatic organs and all those things. Another one is adipose, for storing adipocytes. Energy, insulation, cushioning. Energy, insulation, cushioning. These are the 3 types of loose. Remember I said loose, meaning that the most loose among them is areola. The most vascularized among everything is areola. You can't forget. This is exactly why I have to put this in the slide. The dense, when you're talking about the dense, it means that it is packed. Parallel collagens. If you see, the collagen is parallel. The other one is scattered. This one is parallel. But the difference between the 2 of them, dense, from this word dense, is that it helps to resist tension in one direction. Like what? Like tendons. Look at it. I'm stretching my hand. Don't you know I'm stretching tendons? And also I'm stretching what? Ligaments. So these tendons stop my hand from moving beyond it. Right? So when you have tendon injury, you have muscle or ligament injury, sometimes it stretches beyond. But these ones, they keep it steady. That's dense regular. It is very regular. There's ones that are dense irregular, scattered, but they still resist tension. This time around in multiple directions. Like what? Like your skin. Damage of the skin. Right? An organ, capsules. Some organs you see capsules. Those are dense reticular tissues. Dense irregular, helping to cushion tension from every direction. So if the tension comes here, it protects, comes here, it protects, comes here, it protects. But the dense regular is usually one direction. One direction. This tendon goes this direction. Ligament goes this direction. Please, I need you to know this. Now, look at these diagrams. We have cartilage. This time around, we're talking about cartilage, right? Remember, these are the classification. Back again, cutaneous tissues. We are done with connective tissue, connective tissue proper. We are done with I told you this is the most vascularized. That is the areola. Very, very important for you to know. So we have the dense and we have the loose and the dense. For cartilage, we have hyaline, elastic, and fibrocartilage. That's what we are discussing here under connective tissue. What's the characteristics? No blood vessel, avascular. So if they tell you which one is avascular, think about cartilage. Which one is vascular? Think about what? Areola. There's a reason why these things are mentioned. You need to know. All right? Now, examples of cartilage, we have chondrocytes, we have chondroblasts, we have perichondrium. Right? Chondroblasts are immature cartilage cells. Why chondrocytes are mature cartilage cells? Why you need to know about them is that chondrocytes, for example, they are found in the lacuna of the bones. Usually in the lacuna of the bones. Remember this. Now, there are 3 types of cartilage. We have hyaline, elastic, and fibrocartilage. You need to know where they are found. The hyaline is usually found in the trachea, in the bronchi, all these articular surfaces. That's where you see hyaline cartilage, right? Hyaline cartilage. Then you see elastic cartilage. Elastic cartilage, it contains elastic fibers. That's like your ear, like your epiglottis. That's elastic cartilage. Then we have the fibro cartilage, which this one contains a lot of collagen bundles. Because of that, you remember collagen does not move so much, right? So we find it at intervertebral disc. This is your vertebral disc. So in the middle, there is a fibro cartilage. Same thing with meniscus, maybe it's like the meniscus of the knee. It's very, very important for you to know these examples. Now, when you're talking about bone, characteristics of bone, remember bone is osseous tissue. Now, let me show you where we are because some people are already lost. We've discussed connective tissue, we've discussed we've discussed cartilage. Now we are discussing bone. After that, we discussed the blood. So very, very important for you to know. So for bone, the major things you need to know about bone is that there are two types. First of all, they are calcified, means that the connective tissues that have what? Calcium. There are two types. One is compact, one is spongy. The compact is the strong part, dense and solid, the outer layer. But the spongy is the one inside, the one that is soft, like sponge. Sponge. I forgot what they call sponge in the US. That stuff you use to shower. That's sponge. All right. You have your name for it. All right. But it's spongy, porous. You see trabeculae and all those things. Now, the structure of the bone, the major part I need you to know is the lacuna. The lacuna is that space I told you that chondrocytes are found. Another thing that is found in the lacuna is what? The osteocytes, the bone cells. The osteocytes. So the osteum are the functional unit with central canal. The lamella, concentric layers, we have the canaliculi, these tiny canals that things pass through, and we have the periosteum. But what I need you to know is the lacuna. That's what they usually point to. Lacuna. What does it contain? Spaces containing osteocytes and what? Chondrocytes. When you are talking about chondrocytes, look at it here. You are talking about mature cartilage cells. They are also found in lacuna. So it's very important that you know that these two things are found in the lacuna. Now, when you are talking about the blood, which is the fourth part, the last part of the connective tissue, the blood is the fluid part of the connective tissue, if they ask. We already know everything about the blood. The function is to transport nutrient, gas, waste products, hormones, and also used for defense. You understand? Immunity against infections. What are the components of the blood? We know the components. The major part is the plasma, which is the liquid ground substance. I told you, what is ground substance? Always the gelatinous substances, liquid substances. So plasma is a ground substance for blood. Now, we have other elements that are in the plasma, like the erythrocytes, which is red blood cells transporting oxygen and CO2. We have the leukocytes, the white blood cell, which helps to fight. We have the platelets for clotting. All right? So these are very important. I have to take it very fast. If this video is if I'm going too fast, please reduce the pace, all right? Make it slower. Now we are out of the connective tissue. Now we are in nervous tissue. Nervous tissue. It's very important for you to know that nervous tissue, we have the components, we have the specialization, we have the neuron parts, right? Specialization in terms of communication. There are some that communicates through electrical and some communicates through chemical. Those are the two parts of the nervous system, nervous tissue, electrical and chemical. Another thing is that they are very, very excitable. The excitability, because this is one of your questions, excitability is the ability to respond to stimuli by changing what? Membrane potential. I'm not going into it. Because another thing that could be excitable is what? Muscle tissue. Skeletal muscle. You understand? They are very, very excitable. Very, very, very excitable. Now, the components, we have the neurons, which are the cells. So the nerve cells that transmit what? Signals. That's what you need to know. Other components, supporting components, like what? The neuroglia. Thousands of them, millions of them, especially in the brain. Now, we have the parts of a neuron. We are specifically talking about the neuron because the neuron is the cell. So we're talking about the parts of the cell. All right? There's a part that neurosoma, which is the body. In this body, it contains a lot of the organelles. For nucleus, for protein synthesis, the mitochondria, everything those organelles are contained in the neurosoma, which is the cell body. Now, it has the head. So look at my body as the neuron, right? So this abdominal part and thoracic part is the cell body, contains all these things. Then you talk about the dendrites. This dendrite are like the hair. It receives information. Then we talk about the axon length, which is the long part that goes off. That one sends information to other cells. It's very, very important for you to know this, right? I want you to Google it, look at the diagram, remember it. For AP2, you will now go into nervous tissue proper. And me, I'm going to treat nervous tissue, nervous system next, so that you guys will be able to understand the parts of the neuron and why it's extremely important for you to know. So this is the nervous tissue. So we are done with the blood, with the connective tissue, the epithelial tissue, the nervous tissue. Now the final component is what? The muscular tissue. For the muscular tissue, you need to know that there are 3 types, which are the skeletal muscle, the cardiac muscle, and what? The smooth muscle. Let me tell you, it's no big deal. If you look at the diagram, you will see something. What do you see? This is striated. You see, like this is the Z disc, striated. This one, is it striated? Yes, it's also striated, but it's like intercalated. Look at it from here to here, from here to here, from here to here, from here to here, like a disc, intercalated disc, right? Why this one is very smooth? See, like fishes swimming in the ocean. This is very smooth. That's why we call it smooth muscle. So cardiac and skeletal are striated, but the difference is that skeletal is voluntary. You move it voluntarily. If I want to shake my head, I shake my head. If I don't want to shake it, I'll keep it. If I want to smile, like skeletal muscle. If I don't want to smile, okay. Now, but cardiac is involuntary, beats on its own. Remember the SA node, the connecting of the hearts, connecting the people that give power in New York, right? That's exactly how the SA node is, because it sends power to the heart, for the heart to beat. You know, then in medical school, if I meet someone, I'll be like, "Can you be the connecting of my heart?" And she will blush, and she'll say yes. All right. So the point is that cardiac muscle is involuntary. Skeletal muscle is voluntary. The similarity they have is striation. All right. Now the smooth muscle is involuntary, like the cardiac muscle, but it is non-striated. This is how you can differentiate them. And if you look at the smooth muscle, they have single nucleus in the entire cell. The cardiac, has single, and central nucleus, while the skeletal muscle has multiple nucleus at the periphery. The skeletal muscle attaches to bones via tendons. All right, very, very important for you to know. Now, muscular tissue is composed of elongated cells specialized for contraction. The function is body movement, proportion of substances, heat. So now we just discussed the different types of muscular tissue. And I need you guys to understand this. So now that we are done with the different types of tissue, if they bring any question, you should be able to dissect that question in terms of tissue. All right? Now, there are other things I need you to know about tissue. One of them is the growth and development. The growth and development. What do you need to know about the growth and development? I made it very simple for you. We have hyperplasia, we have hypertrophy, we have neoplasia, we have differentiation, and we have metaplasia. When you're talking about hyperplasia, multiplication, how is it? Is growing through multiplication. Like if they tell you, oh, that there's this young boy and now he's so tall and blah, 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 blah. It's hyperplasia. You understand? Growth through cell multiplication. It's normal. What about hypertrophy? Hypertrophy is that cell did not multiply. Instead, it's expanded, enlarged. That's hypertrophy. Maybe somebody that goes to gym. If you go to gym, you don't grow cells. It can never be hyperplasia. Instead, it was what? Hypertrophy. So gym, hypertrophy, growth, like a child growing up to an adult, is hyperplasia. Remember. Now we have differentiation. Like for example, in the initial discussion, I told you that the bone marrow, it produces what? The bone marrow produces the B and the T lymphocytes, right? The T lymphocytes migrates to the thymus to mature, but the B lymphocyte matures also in the bone, and from the bone, it goes to where? It goes to the lymph nodes. To do what? To differentiate. That's what we are talking about, differentiation. Differentiation is specialization. For example, I came to the US, I write USMLE, I'm going to residency, right? To specialize. This is what my period of what? Differentiation. Specialize. So development of specialized form and function is differentiation. Now, we have metaplasia and neoplasia. Neoplasia is in red because it's abnormal. Remember, never. It is abnormal. That's why it's in red. So abnormal tissue growth is neoplasia. Now, when you're talking about metaplasia, it's changed from one mature tissue to another. For example, the question I asked you initially, if you go to the lungs, you see pseudostratified columnar epithelium, right? I told you that, right? Correct? For smokers, the same thing. Now, but smoking, we change that bronchi from pseudostratified columnar to what? Stratified columnar. Stratified squamous. That is called what? Metaplasia. It's abnormal as well. It's abnormal. So smoking changes pseudostratified columnar of the bronchi to what? Stratified columnar bronchi. which becomes terrible. But neoplasia is growth, abnormal growth, like tumor, right? Now, I need you to look at this to remember. Okay, I'll treat it in question parts. Now, stem cells. Stem cells. We have two types of embryonic stem cells. We have two types of adult stem cells. So as an embryo, we have totipotent, we have pluripotent. Totipotent, pluripotent. They don't really ask this much in the exam. That's why I left it for the last. But, you have to know it. Totipotent and pluripotent for embryonic. So totipotent are the ones that can develop stem cells that can develop into any cell type, including what? Placenta. Any cell type. While pluripotent is the one that can develop into any embryonic cell type, specifically embryonic. Right? So pluripotent stem cells that can develop into any embryonic cell type. What totipotent is the one that can develop into any cell, whether embryonic or non-embryonic. Does it make sense? When you become an adult, we have adult stem cells. That's multipotent. And another adult stem cell, which is unipotent. From the names, you will know. Multipotent can develop into limited cell types, right? While unipotent can develop into only one cell type. Only one cell type. So if somebody asks you, what is stem cell? Stem cell is undifferentiated. It's when you don't know the gender of a baby inside the uterus, for example. It's undifferentiated cell, with potential to develop into specialized cells, right? Like after the USMLE, you want to go to residency, you can go to any arm. So right now, it is what? Stem cell. So you need to remember this. Very, very important for you to remember this. Now, we have tissue repair. Tissue can repair in terms of the regeneration and fibrosis. This one is very straightforward. Regeneration is just replacement of the structural and the functional. Structural and functional. So you have a cut, after it heals and you don't even see it again. That is regeneration. So that part, you feel everything again. Everything, the function is normal. The physiology is normal, but the anatomy is also normal. But fibrosis, the anatomy is normal, but the physiology is not normal anymore. So fibrosis is a replacement with scar tissue. You understand? Normal structure, anatomy, but the function is no longer normal. That's functional replacement. All right? Very, very important for you to know. Like severe wound, like heart attack. Very important for you to know. Now, this is wound healing process. I'm not spending too much on time, but if you have an injury, what happens? There's bleeding and inflammation. Bleeding and inflammation. Good. Now, the blood vessels are around the wound is coming out. Immediately, what the body does is to release histamine. What does histamine do? Cause vasodilation. It dilates to reduce the blood vessel to that particular place, right? Now, the blood flowing to that particular part. Then immediately, there will be clotting. Once it dilates, blood starts moving slowly, clotting will happen, right? Immediately clotting happens. What happens? Clotting has, covered that place from the external world. Immediately, there becomes something known as granulation. What is granulation? Granulation is when macrophages comes in. Macrophages are actually monocytes, mature monocytes or differentiated monocytes. So macrophages will come in and do what? And clean the debris. Clean all the like when you cut yourself, debris has already entered inside. So macrophages will clean it up, form new capillaries, produce fibroblasts will produce collagen. So they may ask you, in which stage of wound healing is collagen produced? It is granulation. In which stage does blood clot form? It is bleeding and inflammation stage. After granulation, they may also ask you, in which stage does macrophages come? That is, if you see macrophages, you are already in granulation phase. After that, there is epithelialization. What happens? We know about the epithelial tissues. They start to do what? To multiply, migrate to that surface, to do what? To cover this injury. Then after that, there's remodeling. It can lead to scar formation or regeneration, right? The process can last for a long time depending on how the wound is. All right? Now, tissue degeneration and death. That is where you talk about atrophy, because I was discussing with somebody, the person was telling me, oh, gymming is atrophy. I said, gymming is not atrophy. Atrophy is something that is shrinking, becoming smaller, atrophy, because of disuse, probably. So shrinkage of tissue cell size or number is what? Cell size or number is atrophy. So atrophy is actually opposite of what? Opposite of what? Hypertrophy. Opposite of hypertrophy. Because hypertrophy is that it increases. Atrophy is that it reduces. All right? So we have senile atrophy, normal in aging, and disuse atrophy when you don't use. That's why you have to use your brain so that your brain does not atrophy. You have to use your brain always. In short, studies have proven or have shown that people that study a lot, that use their brain a lot, that their brain is active throughout their young age, when they grow up, they have low chances of having Alzheimer. Look it up. Now, that's atrophy. Now, we have necrosis. Necrosis are pathological tissues of death, right? What are those tissues? Like trauma, like what could cause necrosis? Like trauma, like toxins, like infections. So necrosis are, a lot of things. We also talk about infarction under necrosis, which is sudden death. Blood supply will stop. The tissue will die. Also gangrene. Gangrene, when insufficient blood, usually happen, like if you see most diabetic patients, some diabetic patients, suddenly blood will stop going to the lower limb. Before you know it, the lower limb dies and you cut it off. Now we have apoptosis. Apoptosis is programmed cell death. Programmed cell death. This is a normal process. All right? Normal process. It's controlled by the system. The cell will die, a new one will be formed, and all those things. So remember, for tissue degeneration, we have atrophy, we have necrosis, and we have what? We have apoptosis. But when you are talking about tissue growth, you are talking about hyperplasia, hypertrophy, neoplasia, differentiation, metaplasia. Neoplasia, metaplasia, they are usually bad, right? But these other ones are normal. And hyperplasia is multiplication, hypertrophy is enlargement, both of them are growth. The opposite of both of them is exactly what we discussed here, which is what? Atrophy, because atrophy is the opposite of both of them. If it's reducing in size, atrophy. If it's reducing in number, atrophy. All right? So it's very, very important for you to know this. Now, we have a lot of things we do with tissue, grafting, and all those things. Look it up later. Now, finally, key differences between these tissues you must know. All right? Epithelial tissues are vascular. Connective tissues are usually vascular because there are some connective tissues that are not vascular. Remember, I said it. You see it in your questions. The muscle tissues are very vascular. Nervous tissues are very vascular, right? Now, these are cell arrangements. Like in epithelial tissues, they are arranged as sheets. Sheets. Remember the things that join them together, right? Remember? Desmosomes. Join it downwards. Hemidesmosomes. Allows things not to pass through them is what? Tight junctions. Allows communication between them like this is what? Gap junctions. Remember. All right? Also, for muscles, muscle fibers are the cells of a muscle, right? Muscle fibers. Then for cells of nervous system, we have neurons and we have the supporting cells. Very, very important for you to know. All right? These are the types of epithelium, the places they are found, the components, the applications, the locations, function. So the anatomy and the physiology of epithelium, everything is found here. You can also look at it later or just Google it. These are common questions that could easily be asked. You comparing tissues, you especially explaining functionalities, you identifying tissues, telling us where they are found, wound healing, and cell identification. Now, as an exam tip, always recognize these things by using your microscope. Very, very important for you to know. Recognize it. Those microscopic anatomy. You understand? You need to look at an epithelium and say, oh, this is simple columnar epithelium. Simple. Just by me looking at it. All right? You need to also discuss the structure and the function. Understand the structure and the function. Understand the structure and the function. Know the specific features. Know the cells. Memorize the location and the specific tissue type. All right? Know I want you to also know the relationships between them. Relationships between them and practice. Do a lot of questions. All right? So I've discussed a lot of questions, and we are also going to discuss more questions now. So I need you to listen attentively. Take your pen and paper, write down these questions. But most important thing is my discourse. I want you to go back and listen to the discourse over and over. Play it when you're driving. Play it when you are, when you are just, about to sleep. Listen to it over and over and over again, and you'll be fine. For any question on tissue. Any question on tissue will not come outside of this, both in your college and in your board exams. AP1, AP2, and also where? In your NCLEX, in your USMLE, in your MCAT. Please, I need you to look at this. Most important, please kindly subscribe to this channel. Kindly like this video. And I need you to tell me that, oh, this video is good, or, oh, I want you to inform so and so. Oh, I watched this video and this video helped me in my exam. Oh, you rate this video very highly. I want you to tell me those things because it will help me to improve. Even when you pass this level, I want you to be able to tell me, oh, I want you to treat this topic for me. I want you to help me sort out questions that I can use to learn so and so and so. All right? Now the question, intercalated disc. You should be able to differentiate them if they give you this diagram and tell you to identify. This is smooth, very, very smooth, no striation. So these two are striated, but this is no striation. This cardiac and smooth, involuntary, but this is what? Voluntary. Now there are cells in each of them. For the skeletal, the nuclei is at the periphery. At the periphery. While for the cardiac, the nucleus is central. Very, very important. So for epithelial tissues, cells are slightly packed with base avascular. Now, in terms of cell arrangements, if you look at it, you will see sheets of cells, scattered cells, bundles of fibers, and neurons. So we look at questions, right? So this. So I put everything down here, so for you to be able to understand properly. Now, what are you supposed to know for your exams? You need to in dash epithelium reach the basement membrane, but only cells that reach the free surface have cilia. Only cells that reach the free surface have cilia. The options: stratified squamous, stratified cuboidal, stratified columnar, simple columnar, pseudostratified columnar. The answer is pseudostratified columnar. What did I say? Look at the question properly. The question said, all cells in the epithelium reach the basement membrane, but only cells that reach the free surface have cilia. Pseudostratified epithelium. Now, there's a question that says, growth in childhood is as a result of hyperplasia. Is it true or is it false? Think about it. What is hyperplasia? What did we say? We said that hyperplasia is the growth through cell multiplication. So what is the answer? Yes, true. Now, this is another question you can just look at, because there's every possibility that somebody can decide to ask you something similar, not exactly, but similar. Right? Now, they can tell you to label all this. You should be able to label all this. This part is trying to help you. This part is telling you to do what? It's telling you to identify it based on the layers, right? If you check this is simple because all of them are touching the basement membrane. This is stratified. All of them are not touching the basement membrane. And this is what? Pseudo-stratified. Some are pretending to be touching the basement membrane. Some are pretending that they are not, but they are actually touching the basement membrane. That's pseudo-stratified. Now, this is in classification in terms of shapes. This is squamous, very flat. This is what? This is what? This is cuboidal, or cube, or cup. Then this is columnar, column. So you should be able to identify this. There's this question that says, rapid diffusion of oxygen and carbon dioxide through the air sacs or alveoli of the lungs takes place through dash epithelium. You have to know this. The options: non-keratinized stratified squamous, keratinized stratified squamous, simple columnar, simple cuboidal, simple squamous. The answer is simple squamous. Simple squamous. Very, very important for you to know. There's a question that says, dash exhibits a lot of apparently empty space and is found in many serous membranes. So what did we say about loose connective tissue again? Specifically areola. What do we say about areola? We said that areola, they are loose organization of fibers found beneath most epithelials and also between the organs. The abundant blood vessels contain all 6 types. Remember this. Now look at the question again. The question says, dash exhibits a lot of apparently empty space and found in many serous organs. If you look membranes, if you look at all these, if you look at the options, look at the option 1 is adipose tissue, dense irregular, osseous tissue, areola. The answer is what? Areola tissue. Not blood, not osseous, not dense, not adipose. The answer is areola tissue. Now, simple columnar epithelium, what is the function? Absorption and what? Secretion, usually. Found in where? Simple columnar, in the uterus, in the uterine tubes, in the lining of GI tract. Now, there's a question about it. Which of the following is not a function of simple columnar epithelium? Absorption, secretion of mucus. The 2 of them are involved, yes. Movement of egg through uterine tube. It is found in the uterine tube, so it's part of it. Movement of embryo through uterine tube. It is part of it. Then filtration. So the answer is filtration, because they say, which of the following is not a function? I hope this makes sense. Now, there's a question I really love about Marfan syndrome. They say, Marfan syndrome is a hereditary defect of elastin fibers. People with this syndrome have what? When somebody has a problem with elastin fibers, the person will be having hyperextensibility of the joints. So you see the joints moving so backwards. So bear that in mind as well. And also, now there's a question that says, Cell changing type to respond to its environment is called neoplasia. Neoplasia. True or false? Neoplasia. But the answer is false. Why? Because neoplasia is actually abnormal tissue growth. Abnormal tissue growth. When you are talking about changing, you're talking about metaplasia. Changing, metaplasia. Multiplying, hyperplasia. Enlargement, hypertrophy. Okay. Now there's a question that says, chondrocytes and osteocytes located where? Chondrocytes and osteocytes located where? Remember what we discussed about bone, osseous tissue. We talked about the classification, right? They are classified connective tissue, right? There are two forms, compact and spongy, which we discussed. Compact is dense, spongy is more porous in the inner structure. Now, the most important thing is the lacuna. Look at it. Lacuna is the space containing what? Osteocytes. So the answer is lacuna. The options: plasma, cartilage, muscle, lacuna, bone. Where are chondrocytes and osteocytes found? In the lacuna. In the lacuna. Dash epithelium provides a moist and slippery surface and is well suited to resist stress. Seen in the dash. Moist and slippery surface. Moist and slippery surface. The options you have like stratified and tongue. Stratified and tongue, no. Keratinized and tongue, the tongue is not even keratinized. Non-keratinized and skin, the skin is actually keratinized. It's not keratinized and skin. The skin is keratinized, but is it slippery? No. The non-keratinized and vagina, I agree. The vagina is slippery. Very slippery, right? And even as much as it's slippery, it is still stratified for it to be able to resist stress, because when it's going in and out, it's resisting that stress. All right? So the answer should be non-keratinized what? Vagina. Non-keratinized and vagina. So non-keratinized epithelium provides a moist and slippery surface and is well suited to resist stress as seen in the vagina. Like the first option says stratified and tongue. First of all, stratified epithelium does not provide moist and slippery surface. It's always for protection. You understand? To make everything you understand. Now, a question says, an epithelium whose cells are tall and narrow, with each one touching the basement membrane. With each one touching the what? The basement membrane. What does it tell you? Tall, narrow means what? Columnar. Touching the basement membrane. Simple. Simple. You get your answer. You get your answer, and you're good to go. So if you look, you will see this is, you see, they are tall. They are tall. All of them are touching the basement membrane. You see? Where are they found? Remember, where are they found? Uterus, uterine tubes, lining of the GI. We've mentioned it before. We answered it in terms of location. We've answered in terms of function. And now we answered it in terms of structure, meaning that this is a very important thing for you to pay attention to. Simple columnar. Now, the covering of body surfaces and the lining of the body cavity is composed of dash tissue. Options: nervous tissue, epithelial tissue, adipose tissue, muscle, interstitial tissue. What's your answer? Think about it. Think about it. If you look at the screen, you are seeing the epithelial tissue, right? Look at the structure, look at the key features. As a recap, what do we say? We say that it covers what? Body surfaces and lines what? Body cavity. That is the answer. That's your answer. Remember, it has a high rate of mitosis because it will come out in another question. Remember, it's avascular because it will come out in another question. But for this question, remember, it is covering the body surfaces and also the body cavity, usually exposed. You understand? Now, there's a question that says, which epithelium is found in the urinary bladder? Remember, it is what? Transitional. Another name for transitional is what? Urothelium. Urothelium. So if you just see urothelium, you pick that answer. But before that, there are other answers. Like found in a urinary bladder has dash epithelium that resembles dash. Urothelium actually resembles squamous epithelium. It resembles what? Squamous epithelium. See how flat it is? See how flat it is? It actually resembles what? Squamous. I need you to remember that. Resembles squamous, resembles squamous, resembles squamous. All right? And also it's stratified, always. Remember. So it resembles stratified squamous, not just simple squamous. Now there is a question that says, after egg is fertilized, the first tissue that appears is called what? Primary germ layers. Very important for you to know. What lines the digestive tract? Mucous membrane. Where is the mucous membrane gotten from? Endoderm. Where is muscle, bone, blood, and all emerge? Mesenchyme. And mesenchyme is derived from where? Mesoderm. I need you to write this thing in sequence. The primary germ layers give rise to epithelium. And if you look at it properly, you will see what I'm talking about. This ectoderm, that's outer, epidermis nervous system, endoderm, that's in respiratory, digestive, mesoderm, middle, mesenchyme, which gives rise to cartilage, blood, and the bone. Just remember that, all right? Now, there is a question that says, scar tissue helps to hold an organ together, but does not restore normal function of that organ, of the damaged organ. The answer is true. Because if you see what I told you here, under fibrosis, what do we say? We say fibrosis is a replacement with scar tissue. Structural is replaced, but not functional recovery, right? But if it is pure regeneration, it is what? Functional recovery as well as structural. So if I may ask you a very simple question, from which primary germ layer is the epidermis of the skin derived? I need you to put it in the comments section below. The epidermis of the skin, which primary germ layer is it derived? So you have to also remember, mesoderm. I mentioned it initially because it's also another question you will see. The dash gives rise to the dash. Let me give you options. Mesoderm gives rise to digestive glands. Is it true? Endoderm gives rise to muscular system and skeletal system. Is it true? Ectoderm gives birth to nervous system and epidermis. Endoderm gives rise to mesoderm. Mesoderm gives rise to endoderm. The answer is ectoderm gives rise to what? Nervous tissue. Ectoderm gives rise to what? Ectoderm gives rise to what? Nervous tissue and epidermis. Remember, you need to know which. This slide is extremely important because they said a lot of questions from it. A lot of questions will come out from it. Kidney tubules are made up of dash epithelial tissue, which is used for absorption and for secretion. What did I tell you about secretion? Cuboida. Cuboida. Simple cuboida. That is for secretion. You don't need to think about it 2 times because they will give you options like stratified cuboidal, like pseudostratified columnar, like stratified columnar, like simple columnar. The answer is simple cuboidal. As far as it's talking about, tubules of the kidney. But when you are talking about things like ureter, like urinary bladder, what are you talking about? You're talking about transitional or urothelium. We've done it before. Now, there's a question that says, dash is associated with rapid transport of substances through a membrane. What is that? Simple squamous. Simple squamous. We've done, there's a lot of questions on simple squamous. You have to be able to know all of them. I won't be able to bring all of them out. So simple squamous, rapid diffusion, transport of substances, right? Facilitated diffusion, filtration, gas exchange, very important. Where? Alveoli, usually, that's what they ask. They hardly even ask all these glomeruli. It's usually alveoli. Whereas dash is associated with resistance. Which one is associated with resistance? Stratified squamous. What is the function? Protection against abrasion, protection against desiccation, protection against what? Pathogens. Everything is resistance. Dash epithelium is the most widespread epithelium. What is it? Stratified what? Stratified what? Squamous. Why? Because it's covering the skin. The skin is the most widespread. Which one is rare? Stratified columnar. I told you. Stratified columnar is always rare. Now, this question, very important. The pseudostratified columnar epithelium of the bronchi in smokers may transform into stratified squamous epithelium. Is it differentiation? Is it hyperplasia? Is it metaplasia? Is it atrophy? Is it neoplasia? Revisiting what we discussed initially, what is hyperplasia? Growth, multiplication. What is hypertrophy? Growth, but enlargement. Enlargement, hypertrophy. Multiplication, hyperplasia. Abnormal growth, neoplasia. And we have differentiation. Metaplasia is what? Change. Example is pseudostratified columnar of smokers, bronchi, to what? You see, this is exactly what they will ask you. So the answer is what? Metaplasia. Now, when you have lifted gym for like 1 year, you notice that some of your muscles have increased in size. This increase in size is due to what? Due to what? Increase in size of existing cells. That is hypertrophy. So your answer is what? Hypertrophy, because they will ask you, is it neoplasia? Is it hyperplasia? Is it metaplasia? Is it atrophy? Is it hypertrophy? Hypertrophy. There's a question, they said, the passageways, what membrane lines them? Especially the passageways that open to the exterior environment. So the membrane that lines passageways that open to the exterior environment is called what? If you look at what we discussed, cutaneous, we say is the skin. Mucous lines passageways that open to exterior. Simple. Chicken, huh? You take your answer. Where are they found? Digestive, respiratory, urinary, because all of them go to the exterior. Digestive goes to the exterior, respiratory goes to the exterior. Even reproductive goes to the exterior. So it makes sense. But if it's inside, closed body is serous. If it's on the skin, it is cutaneous. Very easy for you to remember. So the answer is a mucous membrane. That's mucosa. Now, there's a question they asked about the basement membrane found between dash and dash. Remember, this is the epithelium, this is connective tissue. In between them is basement membrane. The epithelium is staying on top. I've mentioned this before, so I'm not stressing on it. Now, a question here is saying epithelium that consists of more than one layer is called what? This is giveaway. So this is just telling you the concept of this, right? What did we discuss? We classified cell epithelium in terms of cell shapes and layers. Cell shapes and layers. Cell shapes, squamous, slim, or flat, like pizza, cuboidal, like cup for drinking water, columnar, columns, right? In terms of layers, what do we say? We say we have one layer, all of them touching the basement membrane, which is simple, staying above each other. Some of them are not touching membrane, which is what? Which is stratified. Then we have pseudostratified, that is pretending. So the question is, epithelium that consists of more than one layer is called what? Stratified. Simple. You move. Another one is saying an epithelium with a single layer of tall cells will be classified as which epithelium? Tall cells are columnars. Single layer, simple. So simple columnar. Answer, simple columnar. You will see urothelium, you will see stratified, you will see simple cuboid, squamous, you see simple stratified squamous. Answer is simple columnar. Very important for you to know. Now, back to the germ layer. We've been discussing the germ layer. Another question is saying the middle primary germ layer is called what? What is the answer? All of you know mesoderm. Then I ask you, mesoderm gives rise to what? It gives rise to what? What does mesoderm give rise to? If you look at it, mesoderm becomes gelatinous tissue called what? Mesenchyme. Mesenchyme. This mesenchyme then gives rise to cartilage, bone, blood. You need to know mesenchyme. For mesoderm, middle, mesenchyme. Mesenchyme then gives birth to BBC, which is blood, bone, and cartilage. Now, in terms of cells, which cells are contained in the same simple columnar and pseudostratified columnar? If you think about it, they have something in common. What is it? Goblet cell. Goblet. Goblet. Because remember, they are used to push out foreign materials. Those foreign materials, how are they trapped? Through the mucus. What is producing the mucus? Goblet cells. Now, there's a question that's asking about excitability. Which of these tissues can be excited? Because they respond to outside stimuli by changing their membrane potential. Which one is it? There are two of them, which is nervous and what? Muscular. Nervous and what? Muscular. That's why muscular can contract, right? Same thing with nervous. For nervous, they are specialized for signal transmission. So this sends signal to this. Nervous sends signal to what? Muscular, right? So the two of them are the answer. So if you see any question that's talking about excitability, please talk about nervous and talk about muscular. Now let's go back to preparation of slides. A thin stained slice of tissue mounted on a microscope is called what? It's called what? Histological section. Tissue sliced into thin sections. It's known as histological sections. We talked about physection, which is putting in formalin to preserve. Talk about staining, which is colorification for visualization. Then we talk about preparing into smear and spreading, right? And then I told you about the different types of sectioning, which is very, very important for you to remember. Now, your external ear is due to the presence of what? This question is something you cannot fail. Your external ear is due to the presence of what? What? Options: ligaments, fibrocartilage, elastic cartilage, dense irregular, and dense regular. What is your answer? If you look at the board, what do you see here? You see external ear, epiglottis, contains elastic fibers. So they are part of what? Elastic cartilage. Simple. Elastic cartilage. When you're talking about hyaline, you're talking about trachea, bronchi, right? Then when you're talking about fibro, you're talking about all these disc, intervertebral disc, because they are thick collagens. And remember what we discussed about the components. We say chondrocytes, chondroblasts. Chondrocytes, mature cartilage found in where? Lacuna. Remember when we mentioned lacuna the last time? Chondrocytes and osteocytes found where? In the lacuna. Also remember that cartilages are avascular. Now another question is asking about the connective tissue. What are the categories of the connective tissue? Remember, we have the blood, that's the fluid part. Remember, we have the supporting connective tissue, usually the bone. Remember, we have the cartilage or the hyaline elastic cartilage, And remember, we have the connective tissue proper, which are the loose and the dense. The loose is divided into areolar, reticular, and adipose. And the dense is the regular and what? Irregular. Very important for you to know. So cartilage, fluid parts, supporting parts, and connective tissue proper. Those are the 4 categories. So anyone that's outside of it is not a category. And also, when you are talking about glands, you are talking about the endocrine and the exocrine glands. Remember that. This one is a very simple, it's a giveaway. Now, there's a question that is telling you to describe a skeletal muscle. Skeletal muscle is described as dash. We have fibrous and containing gland substance, non-striated and involuntary, non-striated and involuntary. Any non-striated, remove it, because we say skeletal muscle and what? And cardiac are what? Both striated and voluntary. For skeletal, it is striated and voluntary, but cardiac is striated and involuntary. So the first option says fibrous containing, leave that one. That one is talking about something else. Second one is non-striated, that's out. The third one is say non-striated, that's out. The fourth one says striated and involuntary, that's also out. The answer should be striated and what? Voluntary. When they're talking about cardiac, it is striated and involuntary. When they're talking about smooth, it is non-striated and involuntary. Remember. Now, there's a question that asks about skin healing. So with regard to the healing of a skin wound, macrophages does what? What is the function of macrophages? What is the function of macrophages? Under granulation, we say macrophages clean debris. Clean debris. Before collagen starts forming, fibroblasts start forming collagen. They clean debris. They remove unwanted things. They remove, they digest, and phagocytize any debris. That is your answer. Where do we see collagen? Tendons, ligaments, and deeper portions of the skin. Remember that. That's where we see collagens. It's very, very important that you know this. Now, let's talk about the junctions. There's a question that says, in the intestine, that ensures that most digestive nutrients pass through the epithelial cells and not between them. Pass through the epithelial cells and not between them. Remember, we have tight junctions. They form seals between cells, preventing substances from passing between cells. So that substances will pass through the epithelial cells, right? You understand? Through the gap junctions of the epithelial cells. Makes sense. That's the connections. So when the question says, in the intestine, that ensures that most digestive nutrients pass through the epithelial cells and not between them, they're talking about tight junctions. But when they're talking about communication between the two of them, they're talking about gap junction. And when they're talking about the basement membrane and the cell, anchoring the cell, that is talking about hemidesmosomes. When they're talking about holding two cells together, that is desmosomes. I need you to remember these 4 things because they will ask you this question. And now the giveaway question is, the 4 primary tissues are found in adults, include all of the following except. We know the 4 primary tissues are connective, nervous, epithelia, and muscular. So anyone outside it is not part of the equation. Now, finally, this question, an example of a highly vascular tissue is dash. What do we say is highly vascular? Areola. Areola. An example of tissue that is not vascular is what? Cartilage. You have to remember these 2 things. Areola, what? Cartilage. Areola, what? Cartilage. Very, very important for you to remember. Thank you very much for watching this video. I appreciate the fact that you watched this video from beginning to ending. I hope you learned a lot. We treated almost 60 questions, right? Both in between and at the end of the sections. I want you to always come back to this channel, put on your notification bell, most important thing to me, I want you to comment. Comment. If you were one of my students, try to comment. If you are not one of my students, also comment. Tell me what you need. Tell me the next topic you want me to treat. All right? And at the end of the day, if this helped you in your exam, both your college exam, both on your NCLEX, both on your CAT, try and get back to me and tell me it helped you so that I will have the zeal to produce more videos for other people.